Hi, I'm Dr. Kachi from Nitmed Tutorials, in Nigeria International Trained Medical Doctors Tutorials based here in Abuja. And this is Mr. Desmond. And today we'll be taking some common clinical examination questions in the MDCN exams. Okay, so quickly start with the general physical examination. And we always begin our examinations with grip. Remember to always grip your patients, okay? Grip for greet, create rapport, introduce, and take permission. You must always greet, create rapport, introduce, and take permission from your patient, okay? So let's go. Good morning, Mr. Desmond.
Good morning.
Okay, I'm Dr. Kachi. I would like to do some physical examination on you. Can I go ahead, please?
Okay, no problem.
All right, so please, can you kindly take off your shirt and lay on the bed? Okay, as a rule of thumb, you must always remember to examine your patients from the right side of the bed, all right? So I'm on the right side of my patient. So always stay right, always stay right, okay? So the examination, general physical examination, like every other examination, follows the protocol of IPPA. You inspect, you palpate, you percuss, and you auscultate. However, for general physical examination, percussion and auscultation will not come in this case, all right? So we just inspect and palpate, all right? So, and for general physical examination, remember, so that you are systematic and you don't skip out anything, to examine your patient from the crown of his head to the sole of his feet. So you go craniocaudally, you go in that manner so that you don't skip out anything, all right? So we go. A good clerksman is a good showman. You must be seen to be demonstrating, eliciting these signs to your examiner, because that's the only way you can be scored, all right? However, you only have 3 minutes for each station, so you must also complete your examinations which are required of you under specified time, all right? So when you're examining, always remember to recount the overall state of health of the patient. Is your patient apparently healthy or ill-looking? If it's ill-looking, is it acutely ill-looking? Is it chronically ill-looking? Or is it acute or chronic ill-looking? Okay? And if it's acutely ill-looking, is it painful distress or in respiratory distress? And if you state any of this, you must have evidences to back those. Okay? All right, so we inspect very quickly. So I'll first feel the patient's hair, check for the texture of the patient's hair, where you can pick out in diseases like chronic liver disease or chronic malnutrition, all right? So after that, I use the dorsum of my palm and place it on the forehead of my patient to check for the temperature, know if the patient is warm to touch or not, all right? So next, I use my thumb and my index finger. I elevate my patient's eyelids, all right? So Mr. Desmond, open your eyes, please. Thank you. Now, please, can you kindly follow my hand, my finger? All right, thank you. So this exposes the white part of the eye, the sclera, and with this you can pick out jaundice. You can pick out if a patient has jaundice by that examination. Next up, you use your both thumbs to depress the lower lids. Okay, depress lower lids, and examine for palpebral pallor, all right? So you look at the palpebral part of the conjunctiva and look out for conjunctival pallor, all right? So next up, you examine the mouth. Now, while examining the mouth, you must give your patients 3 instructions, which are open your mouth, bring out your tongue, and raise it up, all right? Open your mouth, bring out your tongue, and raise it up. So Mr. Desmond, can you please open your mouth? All right, bring your tongue out, okay? All right, raise it up. Even if you know what to do, remember that your examination is showmanship. You must show your examiner that you actually know what you're doing. Whether or not the patient is normal, whether or not you already know what you're looking out for, but you must act appropriately. You must show your examiner that you know what you're looking out for, all right? So follow your instructions. So next up, you examine for the cervical lymph nodes, all right? So the submental, the submandibular, the preauricular, anterior cervical, postauricular, occipital, all right? So you go in that manner, all right? So always examine for lymph nodes with the tip of your fingers, the palmar parts of your hands, all right? And you rub the lymph nodes against bony prominences. That way you can feel if those lymph nodes are enlarged. You can feel them rubbing against your fingers. Okay, so start with submental. Okay, so now submandibular. Okay, so preauricular. Okay, upper group of cervical. Okay, middle group of cervical. Okay, the lower cervical. Okay, ask your patient to raise up the shoulder. Mr. Desmond, can you raise up your shoulder? Okay, then you feel for supraclavicular group of lymph nodes. Then you go behind the ears to feel for the posterior auricular, and ask your patient to lean the head forward so that you can flex the neck so that you can feel the occipital lymph nodes. So, Mr. Desmond, can you? Thank you. All right, thank you. So that's all for cervical group of lymph nodes. Next, you pick the skin directly overlying the clavicle and check for skin turgor, which is also used to assess for the level of hydration. In our examining the mouth, remember, we look out for things like level of hydration, central cyanosis, pallor, oral thrush, overall oral hygiene. So whatever you see while examining the mouth, make sure you report. It is very important, okay? So if you see the tongue, the tip of the tongue and the buccal mucosa bluish, you know the patient has central cyanosis. And the buccal mucosa is also the best part to check for pallor. So also take note of that, all right? Because it's not obscured as the palpebral conjunctiva may be in some particular conditions. All right, so next up, you examine for axillary lymph nodes, all right? So while examining for axillary lymph nodes, you shake your patient, you hold your patient right hand to right, left hand to left, all right? So when examining for the right group of axillary lymph nodes, you ask your patient, Mr. Desmond, please, can you hold my hand? Thank you. Once he holds your hand, you ask him to swing his arm on yours, on the examining hand, all right? Now you examine the axillary lymph nodes in groups, Now let's recall the groups. We have the anterior group of axillary lymph nodes, we have the posterior group, we have the middle, we have the central, we have the apical, and we have the lateral, all right? So for anterior, you rub against the fold of muscle, moving from the chest wall to the humerus, all right? So you rub against the fold of muscle, okay? Posterior, you rub against the fold of muscle, the latissimus dorsi muscle, okay? Then you go central, okay? Then you go apical, you move up into the apex of the axilla, all right? Apical, all right? Then for lateral, you could hold the patient's hand and just examine the lateral on the medial border of the humerus, okay? So that's for examining the axillary lymph node, and you must do the same for the other hand, okay? Mr. Desmond, please, can you hold my left hand? Thank you. Okay, so anterior, posterior, central, apical, and lateral. Okay, so you are allowed to examine the lateral group of axillary lymph nodes with your other hand. However, all other group of axillary lymph nodes must be examined with the corresponding hand as demonstrated above. Okay, so you just continue looking at the patient, examine the patient, okay, the same manner, all right? So next is that you want to look at the palm of the patient. Mr. Desmond, please, can you place your both palms in front of you? Thank you. So you should be comparing patients' both palms and comparing them with your own palm, okay? You want to look out for palmar pallor. Next up, you ask the patient to turn the palms, okay? So, Mr. Desmond, can you turn your palms? Thank you very much. And you examine them together. You look at the nail beds. Is there an angle formed between the nail bed and the fingers, all right? You look if there's any digital clubbing, you examine, and if you see, you must grade the degree of digital clubbing. Good enough, most of the patients you're going to see in your exams are going to be normal, but you must be seen doing this. So you look at the nails and you stoop so that your eye is at the same level as the nails, okay? Then you check for capillary refill. Doing that, you depress the nail bed and watch out for filling time, all right? So you depress the fingernail against the nail bed and watch out for filling time, okay? So filling time can be prompt or it could be delayed, all right? So you go ahead, you examine the inguinal group of lymph nodes. So you just rub your hand against the junction between the groin, junction between the torso and the lower limbs, all right? So you feel for the inguinal group of lymph nodes, all right? So after that, you go to the foot of the bed and you expose properly, all right? Remember to always expose your patients in examination, all right? Now we want to check for pedal edema. We want to check for pedal edema, all right? So palpate and make sure when you're palpating, you're watching, looking at the patient, checking out for tenderness. So you must not inflict harm while examining your patient. So at every point, you must always look at the patient's reaction, all right? So with the thumb, with both thumbs, you depress on the first metatarsal, all right? So you depress and release, okay? If there's no edema at that point, you move on to the medial malleoli, all right? You depress, still watching the face of the face of the patient, and you release. If there's no edema at this point, there's no point to continue. However, if there's edema beyond the level of the medial malleoli, then you keep on going further, depressing the skin against the medial aspect of the tibia, all right? So you depress always against bony prominences. So you depress the skin against the medial aspect of the tibia, and you go up while still looking at the face of the patient to know the extent of the pedal edema, all right? So if the pedal edema extends up, if the patient is recumbent, you ask the patient, sir, please, can you sit up? Thank you. And you also, with your both thumbs, depress on the sacrum, you know, to get if the patient has sacral edema, all right? And you greet your patient. Thank you, Mr. Desmond.